Buenas tardes a todos y gracias por darme la oportunidad de dirigirme a ustedes hoy y hablarles sobre el rol y la visión de la Junta de Supervisión y cuanto el futuro de salud en Puerto Rico. Muchas gracias, Jaime Pla y la Asociación de Hospitales por la invitación. Y también quiero agradecerle a los profesionales de salud que apoyan esta importante organización y los líderes que han dedicado su vida profesional a los hospitales privados y públicos y que cuidan de nosotros y de nuestras familias cuando estamos enfermos y cuando enfrentamos alguna emergencia de salud. Sin duda, este año ha sido otro año difícil para ustedes y quiero reconocer su servicio al pueblo de Puerto Rico. Otro huracán golpeó nuestra isla poniendo a prueba nuestra fortaleza y nuevamente ustedes enfrentaron el reto. Gracias y gracias a todas las enfermeras y doctores que trabajan con administradores y líderes de salud para ayudar con el cuidado y la sanación de todos. Ahora, nuestra visión para un mejor sistema de salud en Puerto Rico es simple. Mi visión es que cada residente reciba la atención que necesita. El objetivo es simple, pero el camino para llegar ahí es más difícil y es un reto aquí en Puerto Rico y en los Estados Unidos. Ahora bien, si me permiten, voy a continuar mi mensaje en inglés. Prior to moving to Puerto Rico, I worked on 2 healthcare redesign initiatives in the past 20 years in New York. The first ingredient to a successful process is information. Before we can define a plan of how to make a vision come true, we must analyze where we are today. Data and research are essential. Every day I read about healthcare in the media. I see anecdotal evidence of the challenges that Puerto Ricans face and the challenges the healthcare professionals face and the challenges the insurers face and the challenges the doctors face and the challenges that the healthcare industry faces. And most importantly, the challenges that patients face. Our parents, our children, our family members. This is all too real to all of us and is very personal. When I attended the conference last year, you heard me say that these are not challenges that any of us can meet alone. It is something we must do together. It is not one sector's ability to finish and complete these goals. It is something that we must do together. Today, I would like to reiterate that the Oversight Board will continue to work with all the groups and stakeholders to transform Puerto Rico's healthcare system so that it can meet the needs of the people. But before we can find solutions, we need to know precisely what reality we live in today. We need accurate data. Over the last year, the Oversight Board has started to work on 2 main challenges: finance and the lack of data. The data that we need to define the transformation and make priorities of actions that are needed. On the finance side, the Oversight Board approved an increase in the Platino wraparound payment to Medicare Advantage organizations, enhancing access to essential medical services and payments to healthcare providers. That's $35 million invested this year and over $100 million over the next 3 years. The Oversight Board also expanded Medicaid eligibility by increasing the Puerto Rico poverty level for eligibility from 85% to 100% of the federal poverty level. This increase expands healthcare coverage for people and families that experience financial hardship. And we captured individuals who may have lost coverage as a result of the recertification process, with a fiscal impact of over $207 million. This is something that we said we would address last year, and we did. The board approved increased reimbursements to hospitals, enhancements to benefits to expand and support the Medicaid program, including investments of $85 million, including adjustments to the dental fee schedules, expanded coverage for nutritional services, increased reimbursements to hospitals, centers for diagnosis and treatment, physicians, and laboratories. We expanded coverage for durable medical equipment and covering for non-emergency medical transportation and other coverage expansions. This additional funding includes money for hospital accreditations, facility upgrades, and specialized practitioner contracts. The government is budgeted to spend $6.6 billion for healthcare in the current year. It is the single largest government expenditure in Puerto Rico. This year's government budget also includes $20 million to support the Department of Health's disability program and the cardiovascular center. $15 million was added to expand the Ama de Llaves programs in municipalities for the elderly and the people in need, and $9 million in additional funding to improve paramedic response times and capabilities. These are all important funding needs. Working closely with the government was critical to approve this funding. And every year, we work with the government to update the fiscal plan and put together the budget for the next fiscal year. We must prioritize, and there are always, every year, areas where the Oversight Board must say no in order to maintain responsible budgets, but we make sure that healthcare is a priority. That is why the Oversight Board approved all of these increases in spending this year alone. But this is not enough to change the Puerto Rico healthcare system for the better. One of the most essential elements of healthcare are the people who provide care. How Puerto Rico can train and retain the right number of nurses and doctors and provide a career for people in healthcare overall is a concern that we all hear and read about daily. I believe if you are going to identify problems, you should also identify solutions. But Puerto Rico does not have a system to track working healthcare professionals. There is little data about how many graduates stay in Puerto Rico or return to Puerto Rico after completing their residencies elsewhere. It is impossible to address a challenge without an understanding of the problem. Just like you cannot diagnose and cure a patient without understanding the symptoms. So we decided to collect better data. Many of you know this because many of you were contacted as part of this study's work. We, together with the Health Department in Puerto Rico and the FAF, initiated a comprehensive report on the healthcare workforce in Puerto Rico. The report will shed more light on how many nurses and doctors we have and in which areas we have shortages. The purpose of the study is to quantify and to forecast the workforce of the future, explain why there may be shortages, and working with stakeholders like you to formulate and prioritize recommendations for a better path forward. As part of the study, more than 700 healthcare professionals, including doctors, nurses, technicians, and others, were contacted. They were analyzed. They analyzed enrollment records, claims data, physician and emergency room visits, and other healthcare data. The study is being finalized, and we will present it to the public shortly. Some of the results may be surprising. Other conclusions we already have suspected. So far, what we have found is a significant misalignment between how many healthcare professionals we have and how many we need. Notice I said misalignment. That is because there are clearly areas where we see shortages, but also areas where there are too many specialists in certain fields servicing too few patients in other areas. The government has the ability to remove barriers. There are laws and regulations in effect in Puerto Rico which limit the healthcare workforce and access to care. Rules that do not exist in other parts of the country. We want to share this report with you so that you will be able to work with us to find the right solutions and steps to transform the healthcare system. The healthcare workforce is, of course, only one element of Puerto Rico's healthcare system. And even when we have the right number of nurses and retain the doctors that Puerto Ricans need, other challenges remain. Just this weekend, a newspaper report highlighted a 2022 study that about Puerto Rico's rapidly aging population. Outmigration and low birth rates cause Puerto Rico to age rapidly, more rapidly than anywhere else. The percentage of adults over 65 rose from 13% in 2010 to 21% in 2019, according to the Matos Moreno report, and this number will continue to increase. The data is important because Puerto Rico lacks a long-term care infrastructure. Families and informal caregivers bear a disproportionate burden of care. Treatable illnesses go without treatment. Opportunities to manage chronic illnesses and conditions effectively are missed. The lack of a long-term care and elder care infrastructure is straining emergency rooms and resulting in unneeded hospitalizations. Puerto Rico has the longest average emergency department visit duration among the US states, 4.4 hours on average, and almost 2 hours longer than the US average. The social and economic consequences of a rapidly aging population is more than just a healthcare problem, of course. To provide better care for our older residents is a moral imperative, but it's also an economic necessity. Improved elder care will help keep younger Puerto Ricans in the labor force, and it is an urgent issue that we must tackle right now. And of course, Puerto Rico's potentially most significant healthcare challenge is the Medicaid cliff. Under the Federal Consolidated Appropriations Act of 2023, Puerto Rico is eligible to receive over $19 billion in Medicaid funding between the years 2023 and 2027. The law extends the 76% federal Medicaid matching rate, known as FMAP, until only September 30th of 2027, when the fiscal year ends. In fiscal year 2028, Puerto Rico's funding will fall back to the statutory limits unless Congress acts. 2027 will be here faster than we realize. The expiration is a major risk for long-term stability of the healthcare funding for almost half of the population. Moreover, it could further destabilize the healthcare system in Puerto Rico. We can all speculate about what Congress might do, whether future legislation would extend funding and what kind of funding other potential future legislation might provide, but we cannot plan on speculation. That is why the Oversight Board continues to advocate in Washington for a long-term Medicaid solution for Puerto Rico that is fair and is permanent. And our projections in the fiscal plan reflect this scenario. Rather than speculate about the possible extension of the current increased funding, we must work together to prepare for a scenario under which the government of Puerto Rico would become responsible for a significantly higher share of Medicaid expenses. And we will quickly run out of federal funding. We also must understand the real consequences of this outcome. Puerto Rico's elected leaders and healthcare stakeholders will have to work hard to overcome these challenges. And together, we must come up with a practical and detailed proposal to Congress together that would support fair funding for Puerto Rico. We must start now and prepare our case for an equitable Medicaid program for Puerto Rico. I understand that you will hear from the gubernatorial candidates in a panel tomorrow. The proposals that I have heard so far range from promoting medical tourism, creating a retention fund for critical healthcare professionals, establishing a national health insurance for all residents of Puerto Rico, basically dismantling the current health insurance industry. The Oversight Board is a fiscal institution, not a political institution. We do not work with ideology. We are technocratic by nature, but that doesn't mean that we are dispassionate. The Oversight Board is a Puerto Rican organization. Our team is Puerto Rican, the majority of our board is Puerto Rican, and we are part of the government of Puerto Rico. We must work together on a shared vision of providing access of quality health care to all of Puerto Rico. And that starts with a properly funded system. We see too many Puerto Ricans leave their island, and healthcare is a major reason why. I saw it firsthand. Like many of you, family members have left the island because of lack of adequate healthcare. For those that can afford it, they leave the island for certain care. This cannot be the only answer. One of the top barriers given by Puerto Ricans who have left the island and who would consider returning is access to good health care. We need those Puerto Ricans here in Puerto Rico to rebuild the economy. We need to break through the barriers of licensing to attract and recruit and retain healthcare professionals that we need, and we need a roadmap. A roadmap cannot simply be a lower tax rate in the hope that doctors come. It cannot be a roadmap for insurers or government agencies. It cannot be a roadmap for hospitals or for first responders. We need a roadmap for Puerto Rico's healthcare system. Puerto Rico cannot move forward without one. The economic forecasts for Puerto Rico reflect the tremendous effect of the massive amount of federal funding in response to natural disasters and the pandemic. As federal disaster funds decline, economic growth will decline too. We must maintain fiscal balance and prevent returning to structural deficits. The government must maintain spending restraint and prioritize spending initiatives that can be funding through long-term resources. This involves planning. Healthcare must be one of the top priority. We must be willing to accept what the data tells us, even if it means that we must make fundamental changes to policies and action plans. We must be prepared to do so. Data and research will allow us to stay ahead and anticipate the challenges of the future. We just simply cannot ignore them. The Oversight Board will work with the next administration, just as we have worked with Governor Pierluisi, to bring all of the healthcare sectors and stakeholders together to create a roadmap for Puerto Rico to realize the vision that we all share, the vision that every resident will receive the care that they need. This year, we must prepare a plan and include it in the next fiscal plan that is due in the spring. And we must work with the government to execute on that plan. It is up to us collectively. We need to create confidence among the people of Puerto Rico, and that together we will provide the opportunities that they deserve and provide the health care that they need. Every decision, every priority, every project must be seen through the lens of this opportunity of progress and growth. Muchas gracias.